welcome back to another conversation with the Commissioner. It is October, my favorite time of year. It's getting a little cooler outside, the leaves are starting to change, but it is also Breast Cancer Awareness Month, something that is so important for us to talk about. So why don't you introduce yourself and tell us a little bit about the program, about the DeAnna Breast and Cervical Cancer Program.
Sure, thank you for having me.
Of course.
My name's Carol Combs. I'm a registered nurse with the Breast and Cervical Cancer Program through the Indiana Department of Health. Our program is a vital safety net for women that aren't able to afford those vital breast screenings.
Yeah.
So it's a very good program.
Yeah, and you work with people across the state to be able to supply this, and we're actually here at Eskenazi. We're going to talk to a couple of people who are doing the program here at Eskenazi in a little bit, but tell me more about how does the Department of Health support the program?
Yeah, so the Department of Health signs up providers all across the state so individuals can get care close to where they live, work, or play.
Right, that's right.
And they can call one of the regional coordinators to enroll, or they can go right to the facility, such as Eskenazi. They might show up for a screening ma'am, a clinical breast exam, a pap smear, and they can enroll them right into the program. Our regional coordinators also have other resources that could help with other barriers to getting screenings.
Yeah, it's amazing, and we know that early screening leads to early detection, which makes cure and outcomes so much better. Do you have anything that you want women to share, or do you want all women to know about breast and cervical cancer?
Yeah, so early detection's the key. It saves lives, and we also know that women's life circumstances change, and we want you to feel comfortable in calling our program to make sure you're eligible to get services. Do not put off that screening. Call us. We have other resources, like I said, to help with barriers to care. Last year, BCCP served our last grant year that ended June 29th. BCCP screened over 5,000 women in Indiana.
It's amazing. It's really, really amazing. So, okay, go get your screenings. All right, now I'm going to go talk to some people here at Eskenazi. Thank you so much for joining me today.
Thank you.
Thank you. All right, so now we're here in the exam room at Eskenazi Hospital, and to learn a little bit more about what you guys are doing with the IN-BCCP program. So why don't you introduce yourselves, and then we can talk a little bit more about how you're serving Hoosier women.
Perfect. So my name is DeAnna Wesley, and I am the director of the Embrace program. And we started working alongside the team of BCCP back in 2017. I think it's safe to say that we're probably the largest provider in the state.
Amazing.
But our goal is to make sure that, just in general with Embrace, to make sure that all cancer patients have the support that they need. But then with BCCP, we kind of take it a step further to make sure that we're working with the prevention side of things a little bit more.
All right, will you tell us your name and what you're doing? Yeah.
I'm Thania, and I'm one of the oncology social workers. I also started with Embrace as an intern, and I believe I've been here about 3 years. So I do see patients in clinic within our program, but I also manage the BCCP program and work with a lot of our outside clinics receiving referrals and helping these women who don't have insurance or are underinsured get access to their screenings and diagnostics.
Excellent. So if a woman was referred to you, what would that look like? How would that experience be for her?
Sure.
Yeah.
It can be a couple of ways. So sometimes they get referred in from outside clinics who help enroll these women into the program. And then we would help them get scheduled, get in contact with them, have all their paperwork ready when they come in for check-in. And they would have access to screenings if needed, diagnostics. If they needed to come back in the event that they find, some sort of cancer, then we'd help them get them established to receive follow-up care within the hospital.
That's so amazing. Sometimes it's so hard to navigate healthcare systems, so to be able to have that connection, to be able to navigate, especially something anxious. I know a lot of women hesitate to go get their screenings. They're afraid of what the results are, or it's hard to schedule, it's hard to figure out what do I need to do, how old am I, what are my risk factors. So really appreciate that you guys are here and doing that. What do you wish all women would know?
Personally, I feel like as much as we really try to emphasize education and communication and collaboration, I just feel like we still fall short of people knowing that there are resources available. So getting the word out to make sure that people know that it's as simple as making one phone call. Thania does a great job coordinating and navigating all of that. So I just think, people knowing that, if you don't know where to go, that's okay. Make a call. And somewhere you're going to get filtered on to the people that can help.
Awesome.
Yeah.
Any success stories?
Yeah, there's a lot of patients that have been, thankfully, because they get early detection, access to early detection to these types of imaging and ultrasound and follow-up care, they're able to have a better handle in the event that they are diagnosed with cancer, whether it's cervical or breast, have better results in their treatment and have access to being connected to wonderful staff here at Eskenazi, so to follow up with them.
Well, thank you guys both for what you do.
Sure.
Thank you for taking some time to talk to me today. You heard it, everybody. Make sure that you are getting connected, that you're getting screened, that your loved ones are. It is Breast Cancer Awareness Month here in October. Men can get breast cancer too, right? So we want to remind screenings if you are susceptible to that. And yeah, it's just an amazing, great connection between the work that we're doing at the Department of Health and actually getting implemented here at the local level. All right, we'll see you next time.
Thank you.
Thank you.